The cervical cancer screening program started in 2006 in 2 government facilities before expanding to over 150 facilities that we've supported across the country. And this was with financial support from PEPFAR through CDC and technical support from Ministry of Health. In the last 5 years, we have worked closely with the Eastern, Southern, Western and Lusaka provincial health offices in terms of establishing new cervical cancer screening centers. And with that, we have supported the purchase of equipment, we have supported trainings, we have also supported mentorship programs in these focus areas. So we have provided training to over 300 nurses and doctors in screening and treatment for cervical precancer.
We are so grateful. A lot has changed. Like back in the days, we never used to have enough space. We used to screen from MCH, but now with the presence of the prefab, we have our own space and our own time to provide the service without any interruptions. So we are so grateful for the supplies and the equipment that we were given, especially the modern cameras. Now we have the SX70, which has good picture quality, and we're able to take pictures quickly and attend to clients in the shortest possible time. And then we also have consistent supply of consumables, those that we use for us to provide the service effectively. The training of staff has also improved service delivery, in the sense that back in the days we only had a few people that were trained, and those would actually be attached to other departments such as MCH and IPD. So you'd find that the service of cervical cancer would be an option. Like when there are clients to be screened, you'd find that there's no staff to attend to them because only few people are trained. But now we have a lot, and so the service is not affected in any way.
We've not had a shortage of challenges. Some of them include attrition of human resource. When you train nurses and doctors, sometimes you go back to the facility, you find that you don't have the people that you've trained, you have to retrain. And also the cost of equipment, it's quite high in terms of screening equipment as well as treatment equipment. We were the first organization to be identified by Ministry of Health to pilot the screening for cervical cancer using the human papillomavirus testing. So we have worked very, very closely with the central lab, which is the CIDRZ Central Lab, as well as the CIDRZ Cervical Cancer Screening Program to initiate screening using HPV testing. So this is mainly in response to the acceleration for cervical cancer elimination, which is a global call to eliminate cervical cancer by 2030. We have learned quite a lot of lessons within the program. And that is, we have to keep training in case of human resource attrition, because we want the program to continue providing the services to the public. And we also want to just ensure that once the women get to the facility, they are actually getting these services. We've learned that we need to continuously provide mentorship for our providers, because there are quite some changes along the way with policy, and also just to build even more capacity for cervical cancer screening and treatment within the providers that we have trained.